Welcome to the deep dive. Today, we're diving deep, into community health and what makes communities thrive. We're using Community Health Nursing in Canada by Stanhope and Lancaster as our guide. So whether you're studying this or working in the field or just super curious, this deep dive is for you.
What's interesting is that this textbook, it doesn't just define terms. It really challenges us, to rethink how we approach community health.
Okay, so let's start with a basic question. What is a community? I mean, it seems simple, but I bet there's more to it than, meets the eye.
Yeah, you're absolutely right. Stanhope and Lancaster break it down into 3 dimensions: people, place, and function. And what's really fascinating is how interdependent these dimensions are.
So it's not just about geography, right?
No, it's much more than that. I mean, think about it. Where people live, the place,
Yeah.
it influences who they connect with, people, and what they do together to function. This creates, a unique web of needs, resources, and challenges that shape the community's health.
That's a really helpful way to visualize it. So a community could be people, rallying for a new park or residents concerned about safety. It's about, shared interests or concerns, not just physical boundaries.
Exactly. And the textbook even gives some examples, like communities of practice. That's where professionals come together to share knowledge. You can see how understanding these dimensions would make you a more effective community health worker.
Absolutely. Yeah, it's like having, a more nuanced lens to understand the community you're working with. But how does this connect to actual health initiatives?
Well, traditionally, community health followed what's called a community as patient model. So in this model, healthcare providers were seen as the experts, and they would dictate solutions.
That sounds a bit top-down, like telling people what they need instead of actually listening to them.
Exactly. And that's where the community as partner model comes in. Think of it as a collaboration, The community actually works with healthcare providers to identify needs, leverage strengths, and create solutions together.
Okay, that
Yeah.
makes sense. But I'm kind of curious about how this actually plays out in real life. Can you give me an example?
Sure. The book highlights a case where a group of women in a low-income neighborhood partnered with a community health nurse to address food insecurity among children.
Now that's what I'm talking about, a community, taking charge. So what did they do?
They came up with some amazing solutions like, breakfast programs and community kitchens. They even advocated for a community garden. They recognized that access to, healthy, affordable food was crucial for their children's well-being.
That's inspiring. But did their efforts actually lead to lasting change?
Well, here's where it gets interesting. The local government's response was to approve a new bulk discount grocery store in the area.
Wait, so the government's solution to food insecurity was just a bulk discount store. But the women raised concerns about, affordability and accessibility. It seems like their voices weren't truly heard.
Yeah, that's a great point. And it highlights the challenges of truly implementing the, community as partner model. Sometimes even well-intentioned efforts can miss the mark if they don't actively listen to and address the specific concerns raised by the community.
Yeah, this raises an important question then. How do we ensure that communities have a genuine voice in shaping their own, health outcomes? How do we move beyond, token gestures and create real lasting change?
Yeah, those are the questions we need to grapple with. And it starts with recognizing that communities are not passive recipients of care, but they are active agents of change. They are the experts on their own lives and experiences.
Absolutely. So how does this tie into understanding the different dimensions of community health itself?
Well, Stanhope and Lancaster explain that community health also has 3 dimensions: status, structure, and process. These dimensions help us to understand the various factors that contribute to a community's well-being.
Okay, let's unpack that. What does status refer to?
Status is all about the hard data. Think morbidity rates, life expectancy, birth rates, those kinds of indicators. It's like taking the community's vital signs.
Yeah.
Right? Sources like Statistics Canada and the Canadian Institute for Health Information provide valuable insights into, a community's health status.
So it's about getting a snapshot of the community's, overall health.
Exactly. And then you have structure, which looks beyond, individual behaviors to consider the broader factors that can influence health.
You mean things like access to healthcare, education, employment opportunities, safe housing, even green spaces.
Precisely. These are often called the social determinants of health, and they play a huge role in shaping a community's well-being. For example, a community with limited access to, quality education, job opportunities might struggle with higher rates of poverty and chronic diseases.
Right, because you can't expect people to make healthy choices if they don't have access to healthy environments to begin with.
Exactly. And lastly, we have process. This dimension focuses on how effectively a community functions, and its ability to solve problems collectively. It's not just about like the what of the community, but the how well they can address challenges and create positive change.
So a community with like a strong sense of social cohesion, effective communication channels and active citizen participation would score high on the process dimension.
You got it. And here's where it gets really interesting. Understanding these three dimensions, status, structure, and process, helps us to tailor strategies for improvement. And that's what we'll be discussing next.
All right, bring on the solutions. But first, let's pause and hear from you, the listener. What are your initial takeaways from this discussion? What aspects of community health are you, most curious to explore further?
Right.
So we've explored these three dimensions of community health, status, structure, and process. Now, the big question is, how do we actually improve them? Like, where do we even begin?
Well, that's where things get really interesting. The approach we take kind of depends on which dimension we're focusing on.
Okay, so let's say we're looking at status, those, hard numbers like disease rates or life expectancy. What strategies can we use to move the needle in a positive direction?
Prevention is key here. Think about immunization programs. They stop diseases before they even start. So what we call primary prevention.
Okay.
Then you have things like cancer screenings. They aim to catch diseases early on, when they're easier to treat. That's secondary prevention. Stanhope and Lancaster highlight these as really effective ways to improve a community's health status.
So it's like a two-pronged approach. Prevent what you can and catch the rest early. But what about structure? Those social determinants of health seem so big and complex. How can we possibly address issues like, poverty or lack of access to education?
Yeah, it's definitely a challenge, but there are strategies that can make a real difference. Take occupational health programs, for example. They can address health risks specific to certain jobs, like exposure to hazardous materials or repetitive strain injuries. By improving working conditions, we can, directly impact people's health and well-being.
Right, because if you're working in a dangerous environment or feeling stressed and overworked, it's going to take a toll on your health no matter how many green smoothies you drink.
Exactly. And then there are community development efforts that focus on creating more equitable access to resources. Think about initiatives to build affordable housing, improve transportation options, or create, safe, accessible recreational spaces for kids. By addressing these underlying, social and environmental factors, we can create communities that support health and well-being, for everyone.
Yeah, it's like building a foundation for health. You can't expect people to thrive if they're constantly, struggling with basic needs.
Precisely. And that brings us to the process dimension. Here, the focus is on empowering communities to identify their own needs and work together to, find solutions.
Give me an example. How do we actually boost a community's ability to, function well and solve problems collectively?
Imagine a community where families are struggling to, communicate effectively. This can lead to all sorts of issues, from behavioral problems in children to increased stress and conflict within families. So a community health nurse might, facilitate conversations between parents, kids, school boards, even religious leaders to, help them develop family life education programs.
So it's about bringing people together, fostering dialogue and helping them to build the skills they need to navigate challenges and make positive changes.
Exactly. Now, all of this ties into a global movement that Stanhope and Lancaster discuss, the WHO Healthy Cities, Healthy Communities Initiative.
I've heard of that. It's all about, creating environments that support health and well-being, right? Like making sure there are parks and walking trails, promoting, healthy food options and reducing pollution.
Yeah, that's part of it, but it goes deeper than just, physical infrastructure. It's based on the principles of primary health care, which emphasizes community participation and addressing those broader social, economic, and environmental factors that influence health.
So it's about taking a holistic approach, recognizing that health is influenced by everything from the air we breathe to the social connections we have.
Absolutely. The idea is that, people, organizations, and institutions all have a role to play in creating healthy communities. It's not just the responsibility of, the healthcare system. It's a collective effort.
So what does a truly healthy community look like in practice? Paint me a picture.
Imagine a community where residents feel safe and connected, where everyone has access to, essential resources like food, housing, and healthcare. There's a strong sense of, social justice and equity, and residents are actively engaged in, decision-making processes that affect their lives.
That sounds pretty idyllic. Are there any Canadian communities that are like actually putting these principles into action?
Absolutely. The textbook mentions several examples, including Victoria, BC, Buffalo Narrows, Saskatchewan, and Brandon, Manitoba. These communities are taking innovative approaches to address issues like, poverty, social isolation, and environmental sustainability. And community health nurses are often at the forefront of these efforts, working alongside residents to create positive change.
So community health nurses aren't just providing direct care, they're also acting as advocates, educators, and facilitators, helping communities build capacity and take ownership of their health.
Exactly. They're playing a crucial role in translating those, lofty ideals of the healthy communities movement into tangible actions and sustainable improvements. And a key ingredient in this process is collaboration, working in partnership with others to achieve shared goals.
It seems like partnerships are like a recurring theme here. Stanhope and Lancaster really emphasize their importance, right?
Yeah, they're absolutely essential for success in community health initiatives. By pooling, resources, expertise, and perspectives, we can achieve far more than we could alone.
Okay, but let's be realistic. Partnerships can be messy, right? Like people have different priorities, communication can break down, and sometimes it feels like everyone's, pulling in different directions. How do we make sure these collaborations actually work?
Yeah, you're right. It takes work and a commitment to, open communication and shared decision-making. Stanhope and Lancaster highlight several key ingredients for successful partnerships.
Okay, tell me more. What are those magic ingredients?
Well, first and foremost, there needs to be a shared vision and, clear, agreed-upon goals. Everyone needs to be on the same page about what they're trying to achieve and how they're going to get there.
Right, you can't really collaborate if you're not, rowing in the same direction.
Exactly. And it's crucial that everyone feels like their voice is heard and valued. That means, creating space for open dialogue, active listening, and respectful communication, even when there are disagreements.
So it's not just about working together, it's about working together effectively.
You got it. And that requires a commitment to building trust and fostering a sense of, mutual respect and understanding.
So we've talked about shared vision, open communication and trust. Are there any other key ingredients for, successful partnerships?
Well, it's important to establish clear roles and responsibilities from the outset. Who's doing what, who's accountable for which outcomes, and how are decisions going to be made. Having these things, spelled out up front can prevent a lot of headaches down the road.
Right, because ambiguity breeds resentment. Everyone needs to know where they stand and what's expected of them.
Exactly. And it's also important to have a plan for, managing conflict. Disagreements are inevitable. But if you have a process in place for, addressing them constructively, they don't have to derail the entire partnership.
So it's about having those difficult conversations early on and establishing, ground rules for how you're going to work through challenges together.
Exactly. And finally, it's crucial to, celebrate successes along the way. Recognizing and acknowledging the hard work and contributions of, everyone involved helps to maintain momentum and strengthen those all-important relationships.
It's like any relationship, you need to nurture it and celebrate the wins, big and small. Now, can you give me some concrete examples of how these partnerships actually play out in, community health initiatives?
Absolutely. Stanhope and Lancaster highlight several successful partnership initiatives in the book. One is the Homeless Partnering Strategy, or HPS. It's a national initiative that takes a housing-first approach, connecting homeless individuals with stable housing, and then providing wraparound support services to address other needs, like mental health or, addiction.
So instead of trying to address all these complex issues at once, they're focusing on that fundamental need for stable housing as like a foundation for recovery and well-being.
Exactly.
Yeah.
And because HPS involves partnerships between government agencies, community organizations, and people with lived experience of homelessness, it's able to provide a more comprehensive and effective response.
That's a great example of how collaboration can amplify impact. What other partnership initiatives are highlighted in the book?
Another great example is the New Horizons for Seniors program. It partners with seniors, to promote volunteerism, social inclusion, and community engagement. It also addresses issues like elder abuse and supports seniors in, maintaining their independence and quality of life.
I love that this program recognizes the valuable contributions that seniors can make to their communities. Instead of viewing, aging as a decline, it's about empowering seniors to remain, active and engaged citizens.
Exactly. And by partnering with seniors themselves, the program ensures that its activities are, truly responsive to their needs and priorities.
So we've seen how partnerships can be, powerful tools for addressing complex issues like homelessness and supporting seniors. But are there other ways that communities can, take ownership of their health and well-being?
Absolutely. And that brings us to another key concept that Stanhope and Lancaster delve into, community development.
Okay, tell me more about that. How does community development fit into the big picture of, community health?
Think of it as building communities, from the inside out. It's a process of positive social change that empowers communities to, identify their own needs, build upon their existing strengths, and create solutions that work for them.
Sounds a lot like that community as partner model we were talking about earlier.
Exactly. They go hand in hand. The textbook even cites, a framework from the Winnipeg Regional Health Authority that breaks down community development into three key components: capacity building, intersectoral networking, and local area development.
Those sound like some pretty hefty terms. Can we break them down a little? What does capacity building actually involve?
It's about working with the community to, enhance its ability to identify and address its own needs.
Yeah.
It's about recognizing and leveraging, the strengths, skills, and resources that already exist within the community.
So instead of swooping in with prepackaged solutions, we're helping communities to develop their own, internal problem-solving capacity.
Precisely. It's about fostering leadership, promoting collaboration, and equipping, community members with the tools and knowledge they need to create lasting change.
That makes me think of that study mentioned in the book, the one by Horton and McLeod. Didn't it highlight the importance of, engaging community members and sharing their skills and knowledge?
Yes. That study really underscored how powerful it can be when we tap into the wisdom and experience that, already exists within a community.
It's like we're saying, hey, you know your community best. What are your ideas for how to make things better?
Exactly. And this approach is not only, more respectful and empowering, it's also more likely to lead to, sustainable solutions because they come from within the community itself.
So capacity building is about, fostering self-reliance and empowering communities to chart their own course. What about those other two components, intersectoral networking and local area development? What do those involve?
Well, intersectoral networking is all about breaking down silos and fostering, collaboration between different sectors of the community, like healthcare, education, social services, business, and government.
So instead of everyone working in, isolation, it's about recognizing that we're all interconnected and that solutions often lie at the intersection of, different sectors.
Exactly. And local area development focuses on building, strong, vibrant neighborhoods where residents feel a sense of belonging and connection. This might involve things like, improving the physical environment, creating opportunities for social interaction, and fostering a sense of, community pride.
It sounds like all three of these components are, really interconnected. Capacity building gives communities the power to act. Intersectoral networking brings everyone to the table. And local area development creates that sense of place and belonging.
That's a great way to put it. They work together to create a, supportive ecosystem for community health and well-being.
Now I'm curious about the practical side of, community development. How do we actually go about identifying those community strengths and assets that we can build upon?
Well, that's where a tool called asset mapping comes in. It's a process of, systematically identifying and documenting a community's resources, talents, and potential.
Okay, asset mapping. So we're not just talking about tangible resources like healthcare facilities or community centers.
No, it's much broader than that. Asset mapping encourages us to look at the whole picture, including things like individual assets, skills, talents, knowledge, experience, passions, of community members, associational assets, formal and informal groups, clubs, organizations, and networks that exist within the community, institutional assets, schools, libraries, hospitals, businesses, faith-based organizations, and government agencies, physical assets, parks, green spaces, community gardens, public art and historical landmarks.
So even something like, a well-maintained park or a vibrant community garden could be considered an asset.
Absolutely. They contribute to the, overall well-being of the community. And the textbook highlights 3 approaches to asset mapping. The whole assets approach, which aims to, create a comprehensive map of all resources. The storytelling approach, which uses narratives to, uncover hidden assets. And the heritage approach, which focuses on a community's, cultural and historical strengths.
I love the idea of using storytelling to identify assets. It feels so much more, personal and engaging.
It is.
Yeah.
And once we've identified these assets, we can start thinking about how to, mobilize the community to address those, priority health concerns we talked about earlier.
So it's like connecting the dots between the community's strengths and the challenges they're facing. Instead of just focusing on, what's wrong, we're looking at what's right and figuring out how to leverage those assets for positive change.
Exactly. And that leads us to the next, critical step in the community health nursing process, assessment. It's where we really dig deep and gather the information we need to understand a community's, unique needs and strengths.
Okay, assessment time. Sounds like, detective work. What are our tools and strategies for gathering this, crucial information?
We have a whole arsenal of methods at our disposal, but before we, dive into those, let's pause and hear from you, the listener. What aspects of community health assessment are you most curious about? What challenges or, opportunities do you see in this process?
All right, let's dive into the, nitty-gritty of community health assessment. It's like detective work, gathering clues to understand the community's health puzzle. So what are our tools for this investigation?
Well, think of it as like a two-pronged approach. We need, existing data, but we also need fresh insights gathered directly from the community.
Okay, so for existing data, where do we even begin?
Well, think census reports, health surveys, even, minutes from community meetings. It's all out there just waiting to be, analyzed. This data gives us like a broad picture of the community's demographics, health status, and, available resources. It's like getting a baseline snapshot before we, zoom in for a closer look.
So that sets the stage, but then we need to go deeper, right?
Exactly. That's where those qualitative methods that Stanhope and Lancaster talk about come in. Informant interviews, focus groups, participant observation. It's about getting those, nuanced insights that you won't find in a statistical report.
So we're talking to people, observing their daily lives, really trying to understand what makes this community tick. It seems like a community health nurse needs to be a bit of a, social chameleon, adapting their approach to connect with different people and glean those valuable insights.
You hit the nail on the head. Flexibility and sensitivity are key. Stanhope and Lancaster even mentioned the windshield survey.
Hold on, a windshield survey. Does that involve driving around with a clipboard, assessing the community from, behind the wheel?
Pretty much. It's about observing the community firsthand, noting things like housing conditions, the availability of green spaces, the presence of, community gathering spots. It's a great way to get a feel for the community's, vibe.
That sounds fascinating, like taking the pulse of the community, but instead of a stethoscope, you're using your own senses.
Exactly. And all of this information, the hard data and those personal stories and observations come together to form what the textbook calls a composite database.
So we've got this rich tapestry of information. Now what? How do we make sense of it all?
Time to put on our analyst hats. We're looking for patterns, recurring themes, those aha moments that help us understand the community's unique health challenges and assets.
So it's like putting together a jigsaw puzzle, piecing together those individual bits of information to reveal, a larger picture.
Precisely. And remember, we're not just looking for problems. We're also identifying the community's strengths, those resources and protective factors that can be leveraged to create positive change.
Because every community has those hidden gems, those individuals or groups or organizations that are already making a difference. It's about shining a light on those assets and figuring out how to amplify their impact.
Now, once we've got a good grasp of the community's, needs and strengths, we can move on to the planning phase. This is where we start setting priorities, defining goals, and, crafting a strategy for action.
Okay, time to roll up our sleeves and get strategic. Where do we begin?
Well, Stanhope and Lancaster break down planning into several key activities. First, we need to, analyze those health concerns we've identified, digging into the root causes and, potential points of intervention.
So it's not just about treating the symptoms. It's about getting to the heart of the problem and figuring out how to address those, underlying factors that are driving these health outcomes.
Exactly. And this analysis often involves putting together a diverse group of stakeholders: community health nurses, experts in relevant fields, representatives from community organizations, and, most importantly, members of the community who are directly affected by the issue.
It's like assembling a dream team, bringing together all the different perspectives and expertise needed to, crack the case.
Exactly. And once we've, analyzed the concern, we need to prioritize. There might be a whole laundry list of issues, so we have to figure out, which ones are most pressing and where our efforts will have the biggest impact.
I imagine that can be, a tough call, especially when resources are limited. How do we decide which issues to tackle first?
Stanhope and Lancaster outlined 6 criteria for ranking health concerns. First, is the community aware of the issue? Is it on their radar? Second, is there motivation within the community to address it? Are people willing to, roll up their sleeves and work towards a solution? And third, can the community health nurse realistically influence the situation? Sometimes, factors beyond our control might limit, our ability to make a difference.
So it's about being strategic and realistic about where we can make the most impact. What other criteria do we consider?
We also need to think about the availability of expertise and resources. Do we have the knowledge, skills, and funding needed to, tackle this problem effectively? Then we consider the severity of the outcomes if the problem is, left unaddressed. Are we talking about a minor inconvenience or a major threat to, people's health and well-being? And finally, we consider, how quickly we can reasonably expect to see results. Some interventions might take years to show a measurable impact, while others might, yield quicker wins.
So it's about weighing all these factors: awareness, motivation, influence, resources, severity, and time frame to determine which issues are, most deserving of our attention and resources. It's a complex calculation.
It is. But having these criteria helps us to make informed decisions and prioritize our efforts, strategically.
Okay, so we've analyzed the concerns, we've prioritized our top issues. Now what's next?
Time to set, clear, measurable goals and objectives. What do we want to achieve, and how will we know if we've succeeded?
So the goals are our big picture aspirations, and the objectives are the specific, measurable steps we'll take to get there. Can we use an example to illustrate this?
Absolutely.
Yeah.
Let's say our top priority is addressing, infant malnutrition in the community.
Mm-hmm.
Our overall goal might be to reduce the, incidence and prevalence of infant malnutrition. But to make this goal, actionable, we need specific objectives. For example, we might aim to, increase the percentage of infants receiving developmental screenings by 20% within the next year. Or we might set an objective to ensure that at least 80% of eligible families are enrolled in nutrition assistance programs.
So the objectives break down that big, ambitious goal into, manageable chunks, each with a clear way to measure progress. It's like creating a, roadmap for success.
Precisely. And remember, this whole planning process is a, collaborative effort. We need buy-in from the community, not just a plan imposed from the outside. It's about working together to create a, shared vision for a healthier future.
Right, because sustainable change comes from within. If the community feels ownership over the plan, they're much more likely to be, invested in its success. Okay, so we've got our goals, objectives, and a solid plan in place. What happens next?
We move into the, implementation phase, putting those ideas into action. It's where all our hard work and planning start to take shape, in the real world.
Time to, roll up our sleeves and get things done. What are some key considerations during this phase?
Well, Stanhope and Lancaster emphasize the importance of, the community health nurse's role. They can be content experts providing, knowledge and guidance, but also process experts, helping the community develop their own problem-solving skills and navigate the complexities of, implementation.
So it's about striking that balance between, doing for the community and empowering them to do with you. It's about building their capacity to, lead and sustain these efforts over time.
Exactly. The textbook also highlights the importance of community readiness. Is the community actually prepared to, embrace this change? Are there, existing structures and resources that can support these efforts? And, what are the driving and restraining forces that might impact our success?
Yeah, I imagine those forces can be pretty complex, especially when we're talking about, deeply ingrained social norms or power dynamics within a community.
You're right. It's not always a smooth path. Understanding these forces helps us to, tailor our approach and anticipate potential roadblocks.
Stanhope and Lancaster also mention Rothman's 3 models of community organization. Can we touch on those briefly?
Of course. The locality development model focuses on, building relationships and consensus within a community. Social planning uses, data and rational problem solving to address issues. And social action aims to, empower marginalized groups to advocate for change.
So each model offers a different approach to creating change, and often community health initiatives will draw on elements from all 3. It's about, choosing the right tools for the job based on the specific needs and dynamics of the community.
Now, once we've implemented our plan, the crucial question is, did it work? Did we achieve our goals? That brings us to the final stage of the community health nursing process, evaluation.
Time to measure our impact. How do we know if all our hard work has actually made a difference?
This is where those measurable objectives we talked about become, crucial. We need concrete data to assess whether we've achieved, what we set out to do.
So we're looking at those hard numbers, like changes in disease rates, the number of people accessing services, or, improvements in those social determinants of health we talked about.
But it's not just about, quantitative data. We also want to understand the community's perspective. Did they feel empowered by, this process? Do they feel like their needs have been met? Do they see this as a, sustainable solution that they can carry forward even after the, formal intervention has ended?
So it's about measuring both the tangible outcomes and the less tangible impact on the community's overall sense of well-being and empowerment. It's about understanding how this initiative has, changed their lives for the better.
You've got it. And evaluation shouldn't just happen at the end. Stanhope and Lancaster emphasize the importance of, ongoing evaluation, both during the implementation phase, we call that formative evaluation, and after the initiative is, complete summative evaluation.
So it's like a continuous feedback loop, allowing us to, course correct along the way and learn from our experiences. Yeah. What works, what doesn't, and how can we do better next time?
Absolutely. This constant reflection and adaptation are essential for creating, truly effective and sustainable community health initiatives.
Wow, we've covered a lot of ground today. From, defining community to unpacking this entire community health nursing process. It's been an incredible deep dive filled with valuable insights and practical strategies. What a great deep dive.
Yeah, and if there's, one key takeaway, it's that community health is not just about, fixing problems. It's about recognizing and building upon those existing strengths and empowering communities to become, architects of their own well-being.
Absolutely. It's about recognizing that communities are not passive recipients of care, but active agents of change. They have the knowledge, the wisdom, and the passion to create, healthier, more vibrant futures for themselves. Thanks for joining us on the Deep Dive.